Okay. Okay, patient's back. The O-ball implants, 3.0s or 3.25s have healed, and we're ready to finalize the denture. This is a method you can use if you want to avoid a lab step, and if you want to finalize it chairside. So this will be called the direct chairside finalization technique. And what you'll need is a spacer, a spacer O-ring that prevents any of that hard acrylic while it's setting to be embedded into any undercut areas. And then you're going to be needing the encapsulator housing that is the size for the implant that you're using. There's an O-ring inside the encapsulator housing. That O-ring is a different size than the spacer ring. The spacer O-ring is to be used first to be placed on first, and then we place the encapsulator. You're going to be repeating that for each of the implants that are on the patient. This method will allow for the easy transfer of the encapsulator housing into the denture. So you're processing the acrylic that surrounds the housings chairside using a chairside technique on the patient. So when the patient returns, if they are using their final denture that you're going to be finalizing now with the incorporation of the encapsulator housings, you want to make sure that all that area where you cleared it for the soft ring line, all of that area has been cleared to make sure that the encapsulator housing is submerged in its necessary position without any lifting and without any interference. So one way you can make sure that you do that is to place your soft tissue marker. Use your soft tissue marker. This is a Thompson marker. And with a little bit of the patient's saliva, just mark up each head of that encapsulator housing. And then you're going to be repeating this process until that denture is fully seated, clearing all the necessary area for the housing units. And the way one method is to make sure that there's no rocking. If there is a perforation through the denture, you can always repair that with that acrylic, the hard acrylic. An example of the hard acrylic would be the base and the catalyst, powder and liquid. And so what you'd be doing is you're going to be placing that hard acrylic as a soft formula onto the patient's mouth, and we'd be doing them all together. And waiting for it to set, and at the end of the set time, they should all be incorporated into the denture. The spacer will act as an area that's going to be like a little lining that you'll see that's cleared. And you'll take your acrylic burr and just kind of clear any kind of flash of acrylic around there, around each of the housings. And so once it's cleaned up, finalized, and all the housings are incorporated, patients should definitely hear a little snap.